When inspecting the fish, it's important to check the scales and skin thoroughly and as completely as possible. The scales should cover the entire body, and they need to be firmly adherent, not raised or easily removable. This helps ensure the fish's characteristic appearance and health. The skin itself should be intact, without any discoloration, redness, or ulcerations. You also want to look for any visible wounds, parasites, abscesses, or hematomas, and be on the lookout for foreign bodies that shouldn't be there. Finally, the cloaca, which is the opening used for excretion and reproduction, should be pink and not inflamed. It shouldn't have any protruding parasites, especially intestinal endoparasites, and there should be no abnormal secretions. All these details are crucial because they give us a clear picture of the fish's overall health, which ties into the broader theme of ensuring proper care and disease prevention. So, when it comes to heart and respiratory rates in pet fish, it's important to remember that we can't really assess these in the same way as in mammals, since they don't have lungs. That said, we do have tools like the Doppler probe, which allows us to auscultate the heart and listen for things like arrhythmias or murmurs. To do this, we position the Doppler probe ventrally, just below the fish, over the isthmus of the branchiostegal rays, as shown in the photo. This placement helps us pick up the heart's activity. Now, because fish don't have a traditional heartbeat we can measure as a number of beats per minute, what we're really doing is a qualitative assessment. We look for irregularities, murmurs, or other abnormal sounds, rather than trying to quantify the heart rate or respiratory rate with exact numbers. You might also see an ECG in some cases, as in the photo, but that's not something we do routinely with pet fish. It's more of a specialized tool, but it's good to be aware of. Overall, auscultation with a Doppler is a valuable method for evaluating fish cardiac health, even though it's different from what we might be used to with mammals. Now let's talk about the fins, which are a critical part of assessing the overall health of the fish. When inspecting the fins, I gently palpate them from the base to the tip, feeling for any fractures that might appear as nodules. It's important that the fins are intact, meaning there are no breaks or damage, and that they haven't suffered from fin rot, which can cause deterioration. You also want to check that the fins aren't irritated or inflamed, as signs of irritation could indicate infection or other issues. Make sure the fins are well spread, not glued to the body, because if they are attached, it might suggest a parasitic infestation. Additionally, look for any unusual growths or tears in the fin tissue. Parasites are a big concern. There should be no visible parasites on or around the fins. Also, check that there isn't a stump of a caudal fin, which could be a sign of previous injury or disease. Of course, all the fins typical of that species should be present, from the pectoral fins on the sides to the tail fin. In summary, a thorough fin inspection helps us identify potential health problems early on and ensures the fish is in good condition overall.